I'll be speaking today about our work studying the combination of Polatuzumab vedotin in combination with rice chemoimmunotherapy as a treatment for patients with relapsed or refractory diffuse large B-cell lymphoma. This was a multi-center single-arm phase 2 study evaluating whether the addition of Polatuzumab vedotin to the standard of care platinum-based platform of rice could lead to improved outcomes in patients with relapsed or refractory large cell lymphoma. We know that rice remains the standard of care for patients with later relapsing large cell lymphoma, but at the time that this study was initiated, rice was standard of care both for early relapse and refractory as well as for later relapsing patients, and all such patients were eligible. Our results are indeed favorable. We have an overall response rate of approximately 90% and a complete response rate of approximately 60% in a relatively high-risk patient population, including 40% of treated patients having had primary refractory disease. Encouragingly, the toxicity of the combination did not seem dissimilar to that which we would expect from rice alone. There was no significant increase in neurotoxicity. The neuropathy that was seen was largely grade 1 and reversible. Obviously, we need longer follow-up for these patients to see how they did post-transplant, but I would say that these are encouraging results. To briefly describe how the treatment is administered, we administered 2 or 3 cycles of Pola plus rice for patients in the second-line setting. For patients who demonstrated chemotherapy-sensitive disease, they would go on to receive a standard of care auto transplant and then complete whatever doses of Polatuzumab vedotin they're owed, so to speak, with an intention of completing 6 doses of Polatuzumab vedotin in total, which we believe is the appropriate dose number to limit neurotoxicity. We look forward to sharing these data in more granular detail at ASH. Thank you for your interest.